Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Markham.
Welcome, welcome. I'm so glad you've joined us, and I'm glad to be sitting back here. I took a week off, and I'm glad to be back today, meeting with you. And we have a great guest this evening. Dr. Showalter is with us. He's an expert in all sorts of things, especially relating to the back. He's a chiropractic physician, and he's going to be helping with us this evening, answering your questions. And the way you get your question answered, of course, our callers are waiting by at 855-644-3278. Or if you're one that likes to text, our text number is 423-834-7307. And if you don't want to talk on air, that's okay. You can just leave your questions and they can bring them out too. We've also gathered lots of questions for our website. And our website is heartwiseministries.org. And on that website, if you don't watch all the program tonight, Dr. Showalter will be replayed on that so you can watch it again if you might miss something this evening. And on that website, we have a prayer page where we prayed for people this afternoon that needed special prayer. You know, we believe that God is the ultimate physician, the ultimate healer, and remarkable things can be done when we pray together. So we prayed for people this afternoon. We also have a place where you can go and you can ask your questions. And I've got several of those for Dr. Showalter that's come in today. And on our website, too, we encourage you, if you happen to like to go out to eat at a healthy restaurant and write us a review. So we're just so glad you joined us. Remember, at HeartWise, we try to give good answers. Dr. Showalter has given his time today. He's not selling a product or pushing a pill or procedure. He just wants to give you good information to help make your life a little bit better. So stay with us, get us our friends, and don't forget, one of our callers this evening will get this book, Medicines That Kill, in a drawing later this evening. So I'm going to be right back and introduce you to Dr. Showalter after this break. And yes, you're watching The Heart of Health, and we are live.
The Heart of Health Live will return in just a moment. You've got questions, we've got answers on The Heart of Health Live. Welcome back.
We are waiting for your call at 855-644-3278. And one of our callers this evening will get this book, Medicines That Kill, a book that I wrote a couple years ago. It's pretty interesting. It doesn't say that all medicines are bad. It just gives us the appropriate place for them and tips we can do to be more careful. Dr. Showalter, we're glad you joined us.
Thank you. Glad to be here.
So tell us, I guess you were working all day today. I hope you're not too tired.
No.
Okay, well, we're hoping our callers are going to give us some energy and give us some exciting calls. And tell us, what got you interested in healing people and taking care of people and serving the world in this manner through the years?
Well, I was a nurse before I went into chiropractic school, and so being a nurse, you see a lot of people come in the ER. I was an ER nurse, and so you see a lot of people come in with back pain.
Yeah.
And that, it's not the main complaint, but it's one of the biggest complaints that you see there. And I just saw that they were given medicines, and they would come back the next night, same problem, same pain. They'd be given more shots, more medicines, and I was like, there's got to be a better way to approach this problem. And so that's what got me kind of, looking into other things. And then a buddy of mine that I went to nursing school with, his brother was a chiropractor, and so I started talking to him, and that's how I got interested in it.
Now, you have to go for school beyond, for quite a few years in school, don't you?
Yes, yeah, it's very similar to what you have to do for medical school.
Right.
Very similar.
So you spend those years, and then you do an internship somewhere and learn how to...
You do your last year in school and you do an internship. So unlike what you did, a residency, we don't do a residency in a hospital because we don't go see patients in a hospital.
Right.
But we do an internship
with someone.
Similar.
Now, did you have some special expertise that you really liked, or you just sort of liked everything?
Yeah, I mean, there's things you kind of latch onto that you like more than other things as far as techniques and stuff like that. So yeah, I mean, there's things you gravitate towards.
Well, if you want to talk about that tonight, we've
Okay.
got an open floor
All
for
right.
it if you want to sort of throw things out there.
All right.
Now, one of the things that really has interested me through the years is, a lot of different healing, people, doctors, they treat us to treat symptoms, not necessarily causes.
Correct.
But I've always been out there saying that anyone that affects someone else's chemistry, whether it be making someone laugh or feel better or praying for them, they can be a healer.
Sure.
Okay. Now, what specific sort of overall general, approach does chiropractor have to healing? I know that they're not like they don't put a lot of medicine, but they change chemistry in other ways.
Correct. Yeah. Well, your body, can make chemistry on its own.
Right.
What we do as chiropractors is we find the areas that are not functioning correctly, and we get them back to functioning correctly, so that the nervous system can function like it's supposed to. And of course, there's all types of chemicals that come from the nervous system.
Right.
And if it's not functioning right, well, then those chemicals don't get produced correctly. So there's a lot of function and stuff you can correct by doing that.
So you really make our nerves happier.
Correct.
So, of course, pain comes from nerves.
Sure.
Nerves happy. I guess you can eliminate pain.
We try to, yeah. And in some cases we can't, but if we can't, we'll refer someone out.
One of the things I haven't understood very much through the years is acupuncture. That's a nerve way. I guess that does chiropractor get into any of that? Because I know you guys release, put pressure, take pressure off nerves and relieve pain that way.
You can get taught that in school, and I had
Okay.
some friends that got taught acupuncture. But it's a little bit different philosophy. Acupuncture, is Chinese type medicine.
Yeah.
Runs on energy flow.
Right.
It's kind of what they work with, energy
Okay.
flow and resistance to energy flow. And so by putting the needles in, it reduces that energy flow, therefore relieving that tension or whatever is causing a problem there. So it's a little bit different than what we do, as far as ours is based more on impingement of nerves, and your nervous system controls every function of the body. So if it's not functioning right, well, it can affect a lot of things.
Right.
And so that's what we focus on there.
So I guess, what is this model you have with us here?
Well, this is a model of the spine. Of course, these are all the vertebrae of the spine, and there's 24 different vertebrae.
Now point to the vertebra so we know which one it is.
Well, here's a smaller version of it here. These little individual bones are the vertebra. In between are the disc spaces. So you can see each one of these here are the bones.
Okay.
And then the spaces in between are the cushions or the discs. These are your hip bones out here, and these are your leg bones.
Okay.
And then up here is the bottom of the skull. So you
Okay.
can see the back of the skull there. And so that's pretty much what that is there, just a kind of a lifelike version of the spine.
And I guess these are the nerves coming out?
Yes, those yellow things are all the nerves there. So you got two pairs of nerves at each level of the bone there.
Okay, so when a patient comes in with you, I guess with pain anywhere, you've tried to figure out which nerve's involved?
We do, and in
Okay.
some cases when it's it's outside where the nervous system is, sometimes it's a functional problem just with the joint itself, and so
Right.
we can address that.
Okay.
So we address too if it's coming from the nerve, we address that area, but then we also can address any functional problem in the joints.
And then I guess you help make that nerve happier or relieve the
Correct.
pressure?
Yeah,
and
by getting
then-
pressure off that nerve, and therefore it's kind of like you think of a water hose, kinking a water hose, that would be like pressure on a nerve. You unkink it, then that flow can get back to where it's it's supposed to be, kind of like what a nerve would do.
Wow. Now you hear so much about back pain, and I guess you've been practicing now for a few years, or
About 16.
16. So you've seen a little bit of everything for now.
Yeah.
Would you say the most common complaint that comes into your office is back pain, or is it something else?
I would say low back pain and neck pain are the two most common things we see.
Okay. So that goes well with our first question. One of our persons wrote in and says, I've been having low back pain. I went to my medical doctor and he gave me anti-inflammatories. It's still not better. I'm going to work. What would be your approach to that type of patient if he came to you? Where would you start first?
Well, we start out with a good thorough consultation, finding out what the problem may be. Then we move to an exam. We examine the area just to see what the problem may be causing.
Right.
And then from there, we do some x-rays.
Okay.
Because x-rays kind of tell us, and we can see if there may be some other underlying cause besides what we can help them with. Or also, too, showing the alignment of the spine,
Okay.
the functional portion of the spine. And then we can say, okay, well, we've got a problem here. This is what we need to address. And then we sit down with them and tell them how we would address that.
Okay. Now, now what are the different types of ways you can address it? Would you, do physical therapy? Would you sort of, do different hands-on?
Yeah, we call it adjustments.
Okay.
So adjustments is if you have What's called a subluxation is the best way to term it, or a misalignment in the spine. Okay. Those are two synonymous terms there. But a misalignment of the spine would be if we had the spine here, and one is rotated off like that. That's a misalignment or a subluxation. We would then do an adjustment to put that back into place and take the pressure off the nerve coming out here. And so that's how we would address that. Then yes, we do use some physical therapy, rehab, along with that, massage therapy along with that, to address the muscle tissues, you know, those type of things, inflammation and stuff like that.
And you can do that anywhere down the spine?
Yeah, adjustments you're talking about?
Yeah.
Yes,
Okay.
And you can do that at any joint.
Okay.
So we adjust elbows, wrists, you know, hands, thumbs, feet, ankles, knees, all those things.
Okay. Now, if someone gets an adjustment, do they feel better right away, or does it take some time?
Generally, they do.
Okay.
You know, if it's really severe pain, sometimes it might take, you know, a few visits before that pain really subsides, but generally they'll feel better.
Now, this gentleman was taking a non-steroidal for low back pain. It wasn't getting better. I know non-steroidals have lots of side effects, especially GI tract. What are the real side effects of having an adjustment?
Well, really, there's not a whole lot of side effects to it, because, you know, we're doing something, we're applying something to the spine rather than giving something internally.
Okay.
So yes, you can get sore, okay, inflammation, stuff like that, but generally there's not a lot of, you know, side effects to that.
And is this something that will last for a while, or might I have to come back and have this looked at again after a period of time?
Well, like I tell my patients, is you've got 24 different bones moving 3 different directions. So yes, pain-wise we can get that out of there. Correction-wise, you know, it does take some adjustments to get things corrected. To maintain that, we do need to do some adjustments to kind of maintain that. So yes, it can take a little bit, but afterwards, to maintain that, we generally will adjust them on a regular basis.
Wow, that is very interesting. And you know, low back pain is so common, you know. So we're going to talk more about low back pain. If you have a question for Dr. Showalter, our number is 855-644-3278. And Joan, right after break, we're going to answer your call, so stay with us.
The Heart of Health Live will return in just a moment. You've got questions, we've got answers on The Heart of Health Live. Welcome back.
Well, we've had so many questions coming in, and we're going to get right to them after a second. But, you know, going back what we talked to, Dr. Showalter, so low back pain, it's a big problem.
Yes.
That's why you went into it. And I guess our first question was a great place. To me, it makes no sense to me for a person with low back pain to start with a medicine that doesn't necessarily treat a cause.
Correct.
Now, the medicine might help them if they're still in rest.
Yes.
You know, it might help them get over some inflammation,
Right.
but if there's something that needs to be fixed or adjusted, so you know, you could really say that, you know, a good chiropractor is a place to start, and then if something's more beyond that, then you can sort of work up the ladder.
We'll usually refer out if that's the case, but yeah, you're correct. You know, medications just address the symptom, which can help in a certain situation as far as pain, but in order to address the underlying problem, that's what we're going to look at doing.
And back pain is so common. We're going to, after we talk to Joan, we're going to talk about why do we see it so much in our society. Joan, you're on with Dr. Showalter. Go ahead, Joan.
Okay, my son was diagnosed with ankylosing spondylitis. I hope I'm saying that right. When he was 17, and now he's 40, and he's in so much pain in his lower back, and he has tried everything. And everywhere we've gone, they either give him medications that just cover up the pain. He doesn't know what to do with this pain anymore. It's like ruining his life.
Has he tried a chiropractor, Joan?
Well, he's tried just about everything. I mean, they told him to do all kinds of exercises, which he's done. He goes to the gym. Then naturally they put him on every kind of pain pill under the sun, which he really cannot take because he's got an addiction problem. So he wants something that's not non-narcotic, and they don't seem to have, they give him Motrin, but he's on 800 milligrams of Motrin. And it's ruining his stomach. He's always got acid reflux. So he doesn't know what to do next.
Well, I would definitely have him see a chiropractor. I've treated a number of ankylosing spondylitis patients. It is difficult to treat because what it basically does, it starts to fuse these bones, and they don't know exactly why it does it, but it starts to fuse these bones together. and then so it really restricts their mobility. But what I found in my practice in treating that type of patient is if you can get some motion in there, it does relieve some symptoms.
Okay.
And even in the patients I have, it's, may not get them 100% pain-free, but it gets their pain way down. So you might have him go that route or try and, if he didn't get results with one chiropractor, maybe try a different one. I'm not saying that that one is not working for him, but maybe try something else, because you never know. There might be a different technique, or he may be using something a little bit different that may work even better.
Yeah, that's good. Has he worked on some nutrition, Joan? Done that as well?
Pardon me?
Has he worked on his nutrition very much?
Well, I've tried to get him to work on his nutrition. He does eat a lot of junk food, but when he when he stays with me, he gets good food, natural food.
Well, good.
But,
well, that might help, right, Dr.
Oh,
Showalter?
yeah, that definitely helps with inflammation. So, Joan, have him move in with you.
Yeah, there you go.
Then you can feed him well.
Yeah, but some specific things that's very well in the nutrition literature. The whole food, plant-based diet has been shown to help. Avoid lots of fat, lots of processed foods, and a lot of people have had luck with Dr. Showalter. I've heard with ginger.
Yeah,
with anti-inflammation and the omega-3, 6, and 9s, especially the omegas and walnuts. Flax, those are little things that might all help.
Yeah, fish oil especially, and the flax. Those are two good ones.
Well, thank you so much for your call, Joan. Appreciate it. We'll be praying for your son as well. Dr. Showalter, that's very interesting. Have you ever heard of these devices where they stretch people out, these traction devices? Do chiropractors use those, where they, try to stretch out things out to create more space between the vertebrae so there's more space for the nerves?
Well, I use a decompression, which is a little bit different than traction.
Okay.
Traction just pulls straight in and out. Okay. Decompression, what it does, it has a clutch system built into the mechanism, so as it starts pulling, if someone starts to spasm or fight against it, it actually slows down, and so it doesn't create as much irritation or inflammation with that. But yes, we do use that.
You think something like that would help with, ankylosing spondylosis, or is that just too?
I don't think I would recommend it in that case, just because of the fusion that occurs. Some of these bones can get fused together, and you can create some issues with that. I wouldn't recommend it personally, and I've not used that on mine just because of it can create some issues with fractures.
Well, we're going to go to another question that's written in, and this person hurt their back with a lumbar strain, and she's did this by lifting patients. It doesn't hurt all the time. It's the right side hurts more. She wants to know, will it get better over time, or would this be a lifetime problem? We can't probably do anything specific, but we can sort of talk to her about ways that she might help herself and what she might do if it doesn't get better.
Well, the rule of thumb is if it doesn't get better by itself in a week or two, I would definitely go see your chiropractor or someone that knows a good chiropractor, because then they can address that and see if there may be something more underlying that may be causing that. Now, yes, lifting can affect that, but I would definitely go see someone that can, maybe further, address that, because it's something that probably can get better, and it may not be a lifetime, issue.
Yeah. Well, why do we see so many people now with lower back pain and spinal problems? 200 years ago, we didn't see that. Yeah. Why do you think it's happening?
Well, I think a lot of it is we sit a lot in our society, a lot of computers, and that is very bad. I think they said that now that sitting, actually someone who does a sitting job, I think 8 hours or more a day, cuts their life expectancy by, I think, like 8 or 10 years.
Wow.
And so, it affects, exercise, it affects a lot of things, it affects the posture and balance in the spine, so it affects a lot of different things.
So sitting is not very helpful. In the old days, we even sit when we drive.
Sure.
We don't walk very much. We sit in cars. Yeah. We sit at home.
Yep. There's a lot of sitting, but then, like you said before, nutrition has a big role in it too. Because if we don't eat healthy, that affects a lot of other things.
I've met a lot of executives now that are having these stand-up straight desks now, where they don't necessarily sit the whole day long, where they can stand up and
that does help.
Take some pressure off their spine. So, but if we don't get at the cause of the problem, which is sitting, we're only going to have more and more back problems.
Correct.
And even though you might help them short term,
correct,
if we don't change the way we so is part of your encouragement, I guess, is to get up and move and don't sit.
Correct. And then we also teach them, different things that they can do to get their spine to hold their posture rather than muscles. Because we tend to slump, and that's muscles taking over. Muscles weren't meant to hold the posture all the way. The spine is your main, kind of like the main pole in a tent, and then the muscles are basically the little strings off of the tent. And so it's meant to support, not to hold. So we try and teach them how to get the spine to hold that posture.
Well, that makes a lot of sense. Now, you know, with the obesity epidemic we have, that can't help the spine either.
No, just like anything, any added weight to the frame can affect, you know, all your joints, and not just the spine itself, but all the joints.
Now, I guess with people that come into you with lower back pain, do you have a period of like where they rest and they lay off? Because I have a lot of people that don't want to quit working. They want to keep working even though they have the pain. They don't want to let their back heal.
Well, you know, that used to be what was recommended, you know, is bed rest. Unless someone is just really severe, I don't recommend that, because we recommend if we can get the pressure off there and get them mobile, that actually works better than just having them lie down. In some cases, I may have them for a couple of days just to get pressure off of like a disc injury or something like that. But other than that, no, we try and get them mobile fairly quickly.
Now, you know, I meet a lot of people with low back pain that they've been to everybody and their pain still persists. What do you do at that point? I mean, the pain really doesn't seem to get better. Is that time for a surgical referral, or is it a time for just to, you know, say, listen, it's probably safer for you to have a little pain than to take this risk?
Yeah, and that varies per patient.
Right.
I mean, we you know, just like anybody who comes in I've never seen before, we do a thorough exam. We check them out thoroughly just to see if it's something we can help them with. If we can't, I'll let them know, or if we need some referral, then we'll let them do that too.
Okay, good.
Yeah.
Well, we have to go to a break right now, and we still have a lot more questions to get to, and you can give us a call at 855-644-3278. One of you will receive this book, Medicines That Kill. We'll get that out to you. We'll have a drawing at the end, so stay with us. Dr. Showalter is still here to answer your questions, and we're going to be right back after this short break.
The Heart of Health Live will return in just a moment. You've got questions, we've got answers on The Heart of Health Live. Welcome back.
Well, unfortunately, I hope you're not one of those that have chronic back pain, but Dr. Showalter, millions of people have this now.
Yeah.
It really messes up your whole life, doesn't it?
Yes, it does.
When your back's not happy, nothing's happy. And one of the guys that I saw in my office the other day had a lot of bad back pain, and he couldn't sleep well at night. Okay, and because of his back pain, guess what happened to his blood pressure?
Yeah.
And all because of his back. So I said, no, you don't need a blood pressure medicine. We need to get that back fixed up first. So let's see how that does. But we have a person that's written here. She says, I have an impinged nerve in my back. What can we do? So let's talk about impinged nerve first. How do you know it is that for sure? How do you make that diagnosis? And what are things that we can do from impinged nerve, whether it be the neck or the back?
Well, you know, like we talked about before, a pinched nerve is where the bone gets misaligned and pinches there. So what we would do first is, of course, do an exam, do a thorough consultation to see if that is the cause of the problem. X-rays will also help us. You can't see a nerve on an X-ray, but you can tell if the bone is not where it's supposed to be, or things are misaligned where they're not supposed to be. And then from there, we'd set up a course and, you know, care to get it corrected, get the pressure off that nerve. But the best thing to do for her would probably go see a chiropractor and just see if they can help her. It may or may not be able to be helped, who knows.
Now, Dr. Showalter, let's say she goes and you find out that she has a pinched nerve. Does it hurt when you do the exam and, you know, when you're doing these adjustments? There's much pain with that? I know they're having pain already, but is there more pain?
It depends. It also depends on the patient and their severity of pain. Generally, it's not a painful procedure. But some things, when people are in pain, yes, it can be a little bit more tender because of inflammation and stuff that's around that joint that we may, you know, adjust or manipulate.
Now, when you say the word adjust, do you do it with your hands or with instruments, or how do you do it?
Different chiropractors do different ways. I do it with my hands. You can do it with hands or instruments. It's basically getting, you know, the bone back in place, so you can do either or. So there's different chiropractors that do different things.
Okay, so it's just whatever gets that.
Correct, whatever works the best,
Okay. Well, we hope that helps you. So Dorothy, see what she can do. And you know, what would happen if she didn't get this impinged nerve looked at?
Well, you know, it's just like anything, things can get worse. Okay, you know, if that's going to a particular, you know, muscle, you can get weakness in that muscle. Things can start. You can get nerve damage. So things can get worse. So it probably is something if it's impinged now. Usually symptoms are the last thing to show up. So if you're seeing a symptom, it's probably been there for a little while. So you might want to get it checked out, because if you leave it, it can get worse, and you know, then there's other problems that can set up after that.
Yeah, you know, and it seems like one problem can lead to another problem.
Yes.
You know, like a pinched nerve, you don't sleep good at night, your
Sure.
blood pressure goes up, you gain weight, you get
Yep.
diabetes, you get high blood pressure,
All the
and it
above.
goes on and on. If you can get at the
Yep.
cause of the original problem,
Exactly.
you might win the war here. Okay, well, we have another a person that's wrote, and she says, I've got a torn rotator cuff. Do you think, you know, let's talk, but they want to know a little bit about physical therapy versus surgery for a rotator cuff, and she wants to know what is one better than the other. Let's talk about what is a rotator cuff.
Sure. Well, rotator cuff is a muscle back here that just helps to move the shoulder up and down, and there's 4 different muscles there. You can get a tear in it, you can get a full tear where the muscle tears apart, or you can get a partial tear where just if we took this piece of paper and I just tore part of it, that's a partial tear. So it depends on what she has. I would normally start out with something conservative, which in her case, if it's physical therapy, I would start there first, see if that can address it. Then if that can't address it, then she may have to go the surgical route.
Yeah. So,
Address
but it's, you know, it's can be very painful.
Oh yeah.
You know,
Very. I have a lot of patients that have them.
I've had some people can't even put their arm above their head. It gets so bad off.
Yeah.
So that's sort of.
And we do address that with, you know, chiropractic. No, we can't make the muscle come back together, but a lot of times we can get the pain out of there and get that joint moving correctly. A lot of times then the pain may even go away, where they may not have to have a surgery, they may not have to have anything else beyond that.
Well, that's interesting because I saw a patient not too long ago that had something like this, and she was 90 years old.
Yeah.
You know, and she didn't really want to have surgery.
Yeah, and that may not be an
and
option.
that might have been a better option for her to get some mobility
Yeah,
and maybe get
it
it
may not get it 100% pain-free, but it can a lot of times get them back to where they may not have to have the surgery. It may actually heal up with some scar tissue enough to where it can, you know, they can use it enough to where it can, you know, not give them much of a problem.
You know, but I guess one of the things I want to realize is that when you have these structural problems with nerves and bones and muscles, that a good place to start is a conservative place that can get you at the cause of the problem, rather than maybe someone that might just, you know, and a lot of people just aren't trained this way, Dr. Showalter. It's not that they don't want to know this, it's just they don't have the training. So, you know, some said, we'll just take a medicine, hope it gets better.
Sure.
And then don't live with it. If it's not getting better, go see it. Go see somebody.
Yeah, and like you said, you know, it's probably better if you have some type of pain like that to start conservative.
Yeah.
I mean, yes, if it's severe and you need pain medicine, we'll take some pain medicine to get you through that part, but get something to get at the structural cause of it, get that corrected, and hopefully you won't have to take that medicine.
Yeah, and it's interesting that, you know, we have specialists for everything, you know, and you know, if you're going to have a problem with your back and your nerves, you want a specialist that deals with back and nerves.
Correct.
You just don't want to just go to somebody that doesn't really understand the physiology.
Correct.
And it sounds like you are touching bones and nerves every day.
Yeah, I mean, that's what we do.
Yeah,
We do that all day.
Okay, I have a question that's come in through. This might not be off target, but we can try to address it. They want to know a little bit about Parkinson's disease and the pain that deals with Parkinson's disease. Do you ever have people that deal with Parkinson's that come to you?
I do have patients that have Parkinson's. We adjust them, and sometimes it can help them with that pain.
Okay.
In some cases, it might not, though.
Okay.
So it may be an option for them.
And she also asked me about a deep brain stimulator, and I've heard of this, and you know they do it at some, and I've had a couple people through the years that have gone that had severe nerve problems, and they've been helped. And I guess, you know, one person I could refer you to is Michael Fox. He's an actor that has a society with Parkinson's disease, and there's a lot of information on the website about deep brain stimulation. I'm not familiar with all that, but I know some people have been helped with that. I do know sometimes the medicines help a little bit, sometimes they don't. So this is something that you really, and the specialist that deals with this is a neurologist. So I would get with your neurologist and see if this might be something that they might want to do. And a good neurologist will send you to a person that can help with the other issues that might have to do that. But usually the least amount of medications you can be on, the better for when you have a movement disorder.
And just to go on that too, there is a specialty in chiropractic called functional neurology.
What's
where
that?
they get trained in the function of the brain and how to get things corrected using, you know, different exercises and stuff to strengthen the particular part of the brain that may not be functioning right. And I've talked to a guy that does that, and he's worked with Parkinson's patients and has gotten some results with those. So if they want a conservative route to go first, they might try that too. That may be a route to go.
Does your society have a website that our people might want to go to if they want a little bit more information or
Probably the best thing to do is just
Google
functional neurology.
Functional neurology, and you'll get a bunch of sites up
and
there.
They'll bring that up, and it'll give them a lot of good information on that.
Is that a new field? Because I don't think I've heard much of that.
No, it's been around for probably about, I mean, fairly new as compared to chiropractic being around for 100 and something years, but about about the past 20 years.
Well, it sort of makes sense. You know, that's another way to heal the body.
Correct. Yeah.
I'm getting more back its way to time. We have one quick more question before our break here. It says, what does high blood pressure meds do for the body? I guess I'll try to answer this, and that's from Mrs. Foster, okay? Well, you know, I look at blood pressure as a symptom, okay? And you want to know what causes the blood pressure. And if it's come because of pain in the back, get that dealt with. If it's because of extra weight or bad diet or stress or not sleeping, like sleep apnea or bad kidney, deal with the cause. So the blood pressure medicine really just treats a symptom, but you're going to want to get your doctor to try to find the cause. And then if they can find the cause and they can treat it naturally, that's going to be better for you probably than just taking one medicine that just treats one chemical pathway. Remember, these things like we talked about today treat the chemistry of the entire body. So that might help a little bit. Unfortunately, it's time for break. We still have some time for some more calls, 855-644-3278, and we're going to be right back.
The Heart of Health Live will return in just a moment. You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We are so glad that Dr. Showalter has given his time to be with us today. He's not getting any money, he's not getting any special, you know, kickbacks or anything, and we're one of the few programs that does that. We just want to help you out and try to help you along life's way and let you know that we care. We're here willing to listen to you. And remember, there's many different places and many different ways to heal, and just keep that in mind. But the most important thing I want to encourage you with today is start that healing with that relationship with you have with God. Ask Him to help you on your healing journey, to get you to the right people, to lead you to the way, to give you the power to make changes. That is a great first place to start. Dr. Showalter, this next question that's come in has to do with sciatica. You know, a lot of people throw that word around. And what really is sciatica, and how do we approach that?
Well, sciatica is a nerve. Well, it's actually three nerves that come together and make one big nerve going down the back of the leg here in the spine. So this is your hip here and your leg. And there can be some impingements up here in the spine, or sometimes there can be impingements as it goes down right here where there's muscles here in the buttocks area that can impinge on that. So that's what is kind of what sciatica is.
Okay, so once you, so basically sounds like it's sort of, it's a fancy name for low back pain of the lower spine?
Correct, yeah, and it can follow a specific track too. A lot of times people will describe it going down their buttocks, down the back of their leg, and it's a pretty specific, you know, kind of an area where it'll hit there. But
it's still a nerve causing a pain.
Correct.
So someone comes in, I come in and say, I think I have sciatica, and you examined me and you agreed. What would you do next?
Well, again, we would adjust the area where it's being impinged here in the lower back, therefore releasing that pressure on those nerves going down that leg, so therefore then takes away the symptom, which is pain. Could be, you know, irritation, muscle spasm, stuff like that. It helps to address those symptoms by addressing the underlying cause.
Okay. Now, so how would you counsel me? I know a lot of people have sciatica, okay? How would you counsel them so 2 months from now they don't have the same thing happen again?
Well, first of all, we get that pressure off there, get it corrected, try and correct whatever underlying problem is causing that, and then try and maintain that, keep that pressure off of there. Just like we talked about earlier in the segment, earlier in the show, the spine moves 3 different directions, and you have 24 of those. Well, there's no way to keep those. You know, people fall, people, you know, do things, they sleep wrong, they do things where things can slip back out of place. Well, pain, remember what I told you earlier in the show, is the last thing that shows up. So they can have a bone that's out of place pinching without necessarily having pain. We're going to put that back in before it ever gives them a problem once we get that pain out of there in the get-go. Then we're just going to maintain that for them so it keeps moving, prevent it from coming back.
Okay. Now, what type of patients or conditions isn't chiropractic very effective for? Is there certain things that, you know, that have relate to the back, sciatica, that really it's just not going to work? You know, you have a different plan B type of thing?
Well, I mean, yeah, there's things that, you know, people may come in that we may not be able to, like, just to give you, for instance, a disc herniation. There's what's called an extrusion of a disc. It's kind of like someone You ever see a donut with the jelly-filled donut? It's kind of like someone squishing that the jelly donut and that jelly coming out.
Right.
Well, there's stuff inside a disc that can come out and it can free float in there in the spine. Well, most likely we're probably not going to be able to help with that. And so if we see that on an MRI, I'm reading an MRI, and I see that, I'm usually going to refer them out.
I see.
And they may have to have a surgical removal of that.
Well, I see so many people with sciatica. That's what I was trying to get at. Is there some people that the adjustments won't help with sciatica and they need something else? Because I know a lot of people now get shots. You know, they get shots of steroids or pain shots for that. And I understand it helps with the inflammation, gives it a chance to heal on its own. But is there people that just will not get relief by adjustments?
Yeah, and there's some people that may not respond. Now it's a very low percentage, but it can be somewhere anywhere from that 5 to 10% sometimes that may not respond to those things. Generally, when we do a good thorough exam, if I know it's something that I've seen before and we can help them, it'll generally help, and I'll usually tell them that. If it's something we run across where you can get cysts that develop in the facet joint here, which is this little joint in the back here, sometimes you can get a cyst there that can also push pressure there and create some similar symptoms.
Right.
Well, that it may not help with. That again may involve either a surgical intervention to release that pressure on that cyst.
So it sounds like in talking to you today that this is a first step that's a lot safer than maybe jumping up the ladder.
Correct. And always, like I tell my patients, it's always better to start a more conservative route. And I may even tell them too, let's start conservative, see if you respond. If it's not responding, you know, even though something may not have shown up on an MRI, something may not have shown up on X-rays, there may be something else there we need to refer you out if it's not responding like you're supposed to.
So you work with a team of other, you know, of orthopedics and, and neurosurgeons and things. Should you see something that's not responding or needs something more?
Yeah.
Well, that makes a lot of sense because some people jump up to the top and then they know how to do the surgery, but maybe they don't know all this other stuff.
Well, yeah, if you go to a surgeon right off, and surgeons are taught to do surgeries, and you know, of course, they'll do injections and stuff, you know, as conservative route too. Generally, you know, injections, epidural, stuff like that are about a 50-50 shot. You know, you may get, you know, 50% of the time may help, 50% of the time may not. So, you know, it's a hit or miss thing too. But generally, you know, they're gonna recommend what they do. You know, so if you go to them, that's what you're gonna probably expect to see happen.
But it sounds like there's not a lot of side effects with what you're doing.
Not a lot. You know, like anything, there can be side effects, and we explain those, but they're very rare.
Okay, good. So that's good. And a lot of what I'm trying to do is I'm trying to straighten, you know, get everyone to know what different health, because a lot of people don't know what a family practice doctor does, an internist does, a healer that does chiropractic. You know, we just don't know as much as we should. So I'm hoping you're learning things today that will help you understand low back. And I've got another question here regarding headaches. Can chiropractic physicians help chronic headaches? So let's talk a little bit about that.
And again, it's an evaluation process to see what that headache is coming from. But yes, if it is coming from what we call a tension type of headache, those respond very well. That's pinching of a greater occipital nerve that comes out the back of the head here. And when that gets pinched by the nerve or the bone out of place up here, that can definitely cause those headaches. Migraines, it's a little bit hit or miss on those. It depends on what's causing them. A lot of times I find too, it's a diet-related thing.
Right.
So sometimes we'll address a diet-related thing along with adjustments. And sometimes it's just an adjustment thing where we get the pressure off the nerve and then those headaches go away. But 80 to 90% of the time, we can usually help them with headaches.
You know, and you see so many people that are under chronic stress now, makes all the muscles tight. It only makes sense that things push on nerves.
Oh yeah, and that's, you know, a lot of, like we're talking about sitting on computers, so a lot of times they're in this position all day long. Well, you know, that affects a lot of things. Creates trigger points in the muscles too, which are little knots, and the muscles also can refer up just like nerves. And those are created too when the nerve gets pinched. It makes that muscle overfire and makes knots there, which then also can refer elsewhere.
You know, and I think, you know, I don't know this for sure, but I recently took a trip to another country, and they seem so much more relaxed than Americans. I think our society is so tense now. You know, we're going all the time, and I think just teaching people how to rest and take it easy and take some deep breaths and not be so busy all the time.
Yeah, get a good night's sleep. I read a recent research where people who got 8 hours sleep as opposed to 7 hours sleep, those people were just like someone taking 2 alcoholic drinks, just 1 hour difference in sleep.
Wow.
As far as their reaction to different things.
You know, before Edison came along, people used to go to bed when it got dark.
Yeah, exactly. So rest is one of the best things for health.
Yeah. And it used to be that we used to take a day a week off too. But now no one takes a day of rest. Everyone's busy running around, and we wonder why we're so sick.
That
We're
day of
wondering
rest
why
helps.
they're so, and that's what this book here is, Medicines That Kill. When I wrote that book, the leading cause of death in the United States last year was medications.
Yep.
And the leading candidate on that was narcotics. And narcotics are mainly used to treat pain.
Exactly.
So that's scary. So that's why I wanted you here to give some people some alternatives. And it sounds like the earlier we jump on these things, the better.
Yes, I've had a number of patients come from pain management that were, in fact, in their 20s on a number of medicines. Well, what we found is if we can address some of those things, they got off all those medicines altogether, didn't even need those.
Well, that is wonderful. But you know, it takes a big education with patients too. And I'm sure you spend a lot of time with that too. Well, we are going to go to break now. We're going to be right back with Dr. Showalter, so stay with us. You're watching The Heart of Health Live.
The Heart of Health Live will return in just a moment. You've got questions, we've got answers on The Heart of Health Live. Welcome back.
Well, we're glad you're back, and unfortunately, we're running out of time, Dr. Showalter, but thank you for joining us. Mrs. Foster is the one that's getting our book tonight, so we're going to send you The Medicines That Kill. We'll be getting that in the mail for you. And Dr. Showalter, I know we've covered a lot, but you know, the basic points that you want to leave with people tonight. You have like 1 or 2 bullets that if they don't remember anything else, what they want to remember about this visit?
Well, like we talked about, conservative is probably the best route to go first. So if you, like you said, back pain, neck pain, those type of things, usually better go to the chiropractor first. See if that's a route that can help you.
Okay.
And go that route. Like we talked about too, nutrition, exercise, those things help a lot too, and take you a long way to getting healthy.
Yeah, you know, there are many people out there that practice, medical doctors, cardiologists, chiropractors. How do you know, what are some good suggestions that someone that lives far away can find a good chiropractor? Is there anything that they should know, or is it just word of mouth, or is there some ways they can know?
I probably go by, word of mouth referral.
Okay.
That's how most patients get to me, is usually referral from another patient. That's usually the best route. I mean, there are websites you can go to and things like that, but I would say the best thing is word of mouth, getting referred from someone who's actually seen that chiropractor and had good results.
And another thing I always say is see if they're busy.
Yeah, well,
if only one person's coming a day, I don't know what that means. I don't know, or that they're just starting off or whatever.
Yeah.
So that's great. Now, I know you have a practice in the Chattanooga area. If someone might be interested in you getting hold of your website, or what would that website be?
It is chirodc.com.
Chirodc.com. Okay,
Just
we'll
like
make
chiropractor, but just kind of shortened with DC on the end of it, chirodc.com.
Now, I've also heard that chiropractors are treating a lot of pregnancy-related issues too. What kind of things do chiropractors treat related to pregnant females?
Well, I see quite a few pregnant females. The particular technique I use works really well because it's a stand-up technique, so they don't have to lie down. They don't have to do a lot of twisting or bending, which is very uncomfortable for pregnant females. But sciatica is a big thing that we see with them. A lot of upper back neck problems because the belly pulls them forward, and so they tend to go hunched forward. Ligaments get lax as you get further along in the pregnancy, so things come out a little bit easier. So that helps there too. But also too, research has shown by getting adjusted, you can cut your labor time by 50% because it relaxes the muscles too. So therefore, the baby going through the birth canal then come through much easier.
Wow, I wish I'd told my wife about that years ago. She was one that voted for the epidural so quick. You know, we could have said, no, you can be pregnant if you want a little longer here. Well, that's interesting.
I let my wife just decide that on her own.
I think that might be a better idea. But we're done. We're done. We're not going to have. We're done. We're not going to have any more. So
that's what I thought too.
But that's a good suggestion for someone that's having a lot of back pain. I think that's a safer thing for the baby than taking medications.
Correct. Yeah. Always in that case.
Yeah, much better because then the medicines go to the placebo. Well, we want to thank each one of you, and Dr. Showalter, thank for joining us. And I want to remind you again, we're just glad you're joining us, and it's a privilege to come into your home each week. We want to tell you about some of the things Heartwise has been doing. One of the things we're doing is we're getting ready with a new movie we're helping out with. It's called Plant Pure Nation. And it talks about the importance, like we've talked, Dr. Showalter's mentioned, the importance of nutrition in many health conditions and how to get people thinking along those lines. So keep an eye on that, Plant Pure Nations. And we want to invite you to go to our website, heartwiseministries.org. Send us your prayer requests. We would like to pray for you as you pray for us and each other. We'd also like you to write us a restaurant review of a healthy restaurant, because we believe if people will eat healthy foods and know where to go, they'll choose it more likely. So till next time, I'm Dr. James Markham, thanking Dr. Showalter for being with us. Until next time, wishing you the best of health.